Let me do that. Okay, so I'm just going to introduce you briefly that Willie works for an organization called Episcopal Health Foundation. And I came to know Willie about a month ago when Episcopal Health Foundation reached out and talked to us about opportunities we have to partner with them in ministry. Many of you know that Episcopal Health Foundation was formed when the Diocese of Texas sold St. Luke's Hospital. And it has a rather large endowment that is aimed at transforming community health. Some of that goes through parish ministry, but most of it doesn't. Most of the funds that they distribute go to do things like support vaccination or help eradicate structures of poverty in multiple forms. What often shows up at the parish level are things like mental health first aid training or Bridges Out of Poverty training, which many of you joined us for Bridges Out of Poverty. We did that on our own last summer. So that's Willie. And Corlie's just joined us. And Corlie Jackson, her husband, Michael Jackson, many of you may know, helped form St. Vincent's House down in Galveston and get it off to a fantastic start. And Corlie reached out to me about a month ago and said, hey, would your parish be able and willing to support. I had it now.
Corlie, Health and Justice.
Health and Justice.
Advocacy Network.
Absolutely. So I said, of course we want to, and that's probably an inadequate introduction, but that's the one I'm giving. So Corlie, welcome. Thank you, Willie. Thank you, Patty, for being here as well.
Thank you. It's so good to be here. I've been trying to be here. I got here early and then waiting for you, and then it was like, well, where is everybody? So then I had to re-click in again. So I'm sorry, I was early and then now too late.
It's my fault, Corlie. I'm long-winded. They all know that.
Oh, they're thankful for that. Huh? That's yeah. Well, again, my name is Corlie Jackson. Many of you, some of you I've had the pleasure to meet in the past. My heart is on, of course, health and justice, and the intersection of race and poverty. And the thing that we pull on is that as we come together, we go, how can we make it better? As children of God, how do we work together, because we are our brother's keeper, to make things that we can do to make it happen. And since I'm late, I didn't get a chance to say, hallelujah, he is risen.
The Lord is risen indeed.
He has risen indeed. And that is, I love saying that because that is actually why we're here. Because we know a risen Savior who's in the world today. And so HJAN came together because, and I love the simplicity of it. It was basically was that when we look at this, we say that there is a great injustice when our brothers and sisters have such a terrible access or an inaccess almost to healthcare in different ways that contribute to that. And that healthcare therefore speaks to us, to our spirit, our well-being. And as we look at ourselves as spiritual beings in a physical body, we have to acknowledge that we also must take care of the physical body. And that then allows us to go out and do the work he has given us to do. So many of us, from no fault of our own and not from any judgment of whether we consider ourselves valuable or integrated into our society, are falling through the cracks. I myself am one because was a consultant and private entrepreneur in business for myself. And given COVID and everything else, first of all, anytime you work with nonprofits, you have no health insurance, okay? And so all my life, it's about nonprofits, giving back, love, it's my ministry, but I have no coverage, okay? That's part of the sacrifice. But it makes it even worse when you live in a state that when you go to explain and get health coverage, they say, oh, I'm sorry, but you're from Texas, and Texas is one of those states that didn't do coverage expansion. And so you don't make enough to get the after taxes and after I do my stuff as a business, you don't make enough to pay all those taxes. And so you in a realm where you can't get any relief. And I said, so let me understand this. Since I'm not making enough money to afford the healthcare, I cannot get any subsidiary or help assistance to get health care. So because I make the lowest, I have to pay the highest. Is this what you're saying? And the woman was almost in tears saying, yes, that's what I'm saying. Okay. And I know many of you, I was sharing this with some of my members of church, and some really got it right away, but others are like, well, we're 65, we got Medicare, we're gonna make it. But I tell you, our children and our grandchildren are facing this. I know that my granddaughter just had a baby, and she just realized when I was telling her about all the work we're doing that she's not covered. The first 2 months are covered, but after that, no. And she says, well, how can that be? I have an appointment next month. And I had to say, well, that's right. You have an appointment. That has nothing to do with coverage. You and the baby have an appointment. So let me tell you a little bit. Congregations across the diocese are coming together. And as we look at our mission as a church and as a diocese, that's how it began, to say that there is an injustice in that. And as we look at the intersectionality of race and poverty and health, we said, we who love the Lord have to step up and do something. And as our bishop has said, as we look at the way of love, love is an action verb. Okay, and so these are the things that we can do here on earth with the energy that we have, driven with the love that God has put in our heart to make some things happen. So that's how it began. And we began also on this level as an acknowledgement that 1 out of 5, this is just sharing with you, and Willie will do this presentation, but 1 out of 5 people, that's adults 18 to 64 in Texas, so that's about 3 of us in this right here. That would mean 3 of us have no coverage at all. And that was before the pandemic. So since the pandemic, honestly, it's looking like 3 out of 5. So just count 1, 2, 3, and that person has either no insurance, and the other 2 generally have underinsured. So it's just absolutely awful. But that's why we're here. And that's why we've come, and that's why we're coming to us, because it was our hope that congregations would reach out in an outreach to do what they can do on this level. So that's how it began. That's why HJAN. And I wanted to introduce again Patty Peacock, and to talk about what some of the things HJAN has done, because we've been around from before the coverage expansion, but for the same holistic approach to ourselves as being whole. Miss Patty, would you share with us?
Yes, I joined HJAN, many months ago, when through a message from the Episcopal Health Foundation, I became aware of the work it's doing. And it really grabbed me to become involved, because our grandson was born with a heart defect that required 2 open heart surgeries before he was a month old. They left one of his vocal cords damaged because of having to put the tube down his throat. And immediately he began receiving physical and occupational therapy. Physical and occupational therapy to help him learn to form words with 1 vocal cord so he could learn to talk correctly. Cuts to Medicaid ended those therapies, and because our daughter's income, as Corlie was saying, was too high for him to qualify for CHIP, but too low to afford paying for it herself as a teacher, elementary school teacher. The coverage gap you just heard about, he did without the therapies for 3 years. This left him ill-prepared to start school. And although he's in a class designed to help him to learn to form words correctly, his progress has been severely impeded by the absence of the one-on-one instruction he got through Medicaid in his first 2 years. This will continue to critically impact his success in school and in life. He's in 2nd grade now, and we're told that language development peaks in 3rd grade. Imagine your child or grandchild's future determined by the time he or she is 8 years old. And in 11 years, when he turns 18, he will still fall into that gap Corlie talked about if we don't expand coverage in Texas. I cannot implore you strongly enough to do all you can to make sure that coverage expansion happens in Texas. Even if it turns out that it's too late for Casey, my sweet Casey. Please support this effort so that other children who face this and other sorts of challenges will get the help they need to thrive. In my opinion, it is absolutely unconscionable that almost $5.5 billion are left on the table unused every year because Texas is too proud to accept federal funding. The children and families of Texas deserve better and are counting on the people of Texas to make it happen. We shouldn't have to make a decision between having insurance and feeding our families. HJAN, in an effort to convince the legislature to pass the bills necessary for coverage expansion, has tried to contact them and get our message known in a number of ways. We've sent postcards, specially designed postcards that talk about HJAN on the front side. Letters, phone calls, email. We've even ventured into Facebook and Twitter. There was a news conference before the session on Monday. We need a hearing on our coverage bills. Remember these numbers: 290-133 and 3871. Those are the bills that we need to pass, and we need everyone's help. And all the things that I talked about, well, except the news conference, how to do them and how to record them so that they get counted, are all on the HJAN resource page, which you will hear about in a minute. Thank you for listening.
Thank you, Patty.
All right. Thank you so much. Again, my name is Willie Bennett. I'm a Congregational Engagement Officer with the Episcopal Health Foundation. The foundation has long done research in the area of Medicaid and coverage expansion, and helped support several papers that were written about this. But they took extraordinary action starting last fall to really push for this because of the impact it can have statewide on the overall health of the state. Now, the foundation has three parts. We have the most famous part, which is the money part, the part that gives money. Okay, that's not me. Okay, that's the other side of the hallway. Then we have the research department, which is a growing department and is growing in respectability and recognition around the country as being a go-to source for information about health in Texas. The division I work in is congregational engagement, and that is where we engage congregations. So there are many things that the foundation does to support congregations. One, by providing the health coverage for clergy, also providing resources for study, conferences, et cetera. And also we provide support through our In Commons for congregations to come in and learn new and innovative things. And we are working now supporting congregations in initiatives, starting with the census last year. I began working with congregations interested in the census, and then asked a simple question, are people interested in health policy? And that answer was yes. And that led to the HJAN network. The first thing HJAN did was get out the vote work last fall. And that then morphed into the organization wanting to work on Medicaid expansion. The foundation is all in on Medicaid expansion. They've been very public about their support. HJAN members who've only been together for a very small amount of time, they have made over 500 contacts with the legislature just since February. It has been a phenomenal effort from Episcopalians in Texas. And so I want to share with you why this issue is so important. And we'll talk more about what we can do to move it forward. So the basics again, nearly 1 in 5 people in Texas are uninsured. We are number one. We're number one in the country for uninsured, something that we shouldn't want to be.
Yeah, we don't want to be on the top of that list. We don't want to be on the top of that list.
We're at the top, and it's really not that close. So nearly 1 in 5 people is uninsured, and it's because of how we do insurance, right? That's so 47.6% of people get their insurance from their employer. Okay, but what if you're unemployed, or what if you're self-employed, or what if your employer doesn't offer you insurance? What do you do? Well, that's why we have this issue. 18.4% uninsured, Medicare 10.9%, 15.9% Medicaid, 5.7% individual insurance. So 18.4% uninsured. So out of the more than half that don't have employer insurance, we've got to figure out a way to get insurance. Some of that's through Medicaid, some of that's through Medicare, some individual insurance, but we have this big gap right here. Now, what about Medicaid? Well, Medicaid excludes most adults. If you can walk and breathe, you are not on Medicaid, okay? Texas excludes adults from Medicaid, almost all adults, with very few exceptions. One exception is if you are pregnant. Another exception could be if you are disabled, but that's not a guarantee. So if you are an adult, you need to make, with a family of 4, less than $400 a month to be on Medicaid. Let me say that again. To qualify for Medicaid in Texas, for a family of 4, you need to make less than $4,000 a year, which is less than $400 a month.
And that's for a family of 4.
For a family of 4, family of 3, it's around $300 a month. Family of 3, but these are the numbers for the family of 4. Okay, so Texas Medicaid excludes most adults, and only 74% of the disabled are covered. If you are childless and you are not disabled and you are an adult, then you are not eligible for Medicaid. Texas has the most strict and stringent guidelines for Medicaid in the country. So the most stringent, and it is designed for people to not be on it, okay? And many of those who are only on it temporarily because they're pregnant.
Right, that's what for my granddaughter, that's what happened with that for her. Because
right, and Corlie will talk about that in a little bit. And so the Affordable Care Act sought to close the gap by expanding Medicaid across the board, allowing coverage to citizens with incomes below 133% of the poverty level. So that's what the ACA wanted to do. So across the country, provide coverage for those up to 133%. So those who did not qualify for Medicaid could get into Medicaid expansion and have coverage. So, but Texas decided not to opt in to Medicaid expansion. It's one of 11 states that has not opted in. So that has created the coverage gap, which is in red. So this is the beginning of the subsidies, where you can get a subsidy for your healthcare at this level here. This is the area where there's a gap between Medicaid and the subsidy. Medicaid expansion would fill these gaps. Everybody follow me?
Mm-hmm.
Medicaid expansion would fill the gaps in the red, but Texas chose not to opt in. So now there's just a gap, but it gets better. It gets better. Texas hospitals had anticipated that the state would accept Medicaid. I mean, everybody had anticipated, and they didn't. So that created a problem because everything was planned on this gap being covered by Medicaid expansion, but the state didn't do it, so they had to scramble. And one of the things they did was they gave a little bit of money to help pay for some of the uncompensated care in a waiver, 1115 waiver, which is not coverage. It just pays for some of these people when they go to the emergency room. Okay, that's overly simplistic explanation of it, but basically Texas left these folks in the lurch, okay, with no coverage for care. This is the estimated number, a conservative estimate of the number of Texans that gain coverage if Texas expanded Medicaid, extended coverage, 1.274 million. A lot of people, not the entire 5 million, but a good chunk. There is no one thing that the state can do that will approach this number. There's nothing that the state could do that approaches half that number. And there's nothing the state can do that even approaches a third of that number because it would cost too much. So Medicaid expansion is the single biggest thing that the state could do to provide coverage for millions of Texans and provide relief to county hospitals and rural hospitals in particular. So quickly, these are some demographics of the people who become eligible under Medicaid expansion. 76% of workers, of adults, are in working families. So most people who would qualify for Medicaid coverage, expansion coverage, are working adults. 74% are people of color, mostly Latino. 20% are white, 26% are white, 13% African American. So we're talking about working families and many people of color. And quickly, the impact. Well, we know the impact now of coverage expansion because now so many states have taken it, particularly several conservative states. And it has lowered the uninsured rate in those states. So that we know. It's improved health for persons who are low income in those states because now they actually have coverage. Instead of using the emergency room as your primary care provider, you now actually have coverage, and people have taken advantage of that, and they're healthier. This is why the foundation is pushing for this, because we want people to have coverage, not to use the emergency room as their primary care physician. More access as well. It is shown that this would be revenue neutral for the state, at the worst, revenue neutral. But most of the predictors say that it will be have a positive fiscal note. In other words, the state will make money, okay? Also, part of the arguments against this has been, well, look at the big price tag. But the problem when looking at that cost is what you're not looking at is the hidden costs that are paid by every county for uncompensated care. Every county has to pay for uncompensated care. And where does that money come from? It comes from your tax dollars. But that money in aggregate is not put together to see what that cost is. And it's left out of many equations when people talk about Medicaid expansion. And it would provide property tax relief because of you would now have funding to pay for uncompensated care. People were getting regular checkups instead of going to the emergency room, which is more expensive. And you would actually save money in a system that's more efficient. Here, this just talks about the boom for the hospital sector on this, what it would do for the labor market in terms of increased jobs. And it also talks about, preventing the closing of hospitals. So those are some slides that speak to that. So any questions so far on what I've said before we get into what needs to happen? No? All righty. Well,
Willie, if it's okay to just interject real fast, if you have a question and you don't want to lose it, you can just put it in chat. And I'm positive that Willie or Patty or Corlie will pick it up.
I skipped us. Pat, did you want to say anything more here? I've got a couple of stories to share as well, just real quick. And Corlie?
My life has been the story, and it's really interesting since our ministry at St. Vincent's House had a clinic, but the clinic was run by students and or nurses. So when I had a non-COVID event, I was basically had to go to emergency. And when I was trying not to do that, and I had to go to coastal, the 4 C's is what, if you all may remember 4 C's, they couldn't see me right away. They told me, now I had basically adult mumps, was closing off my air passage and my swallowing, throbbing, just made me, so I had like a growth on the side here. And they're saying, well, you're going to have to bring in your income check, your driver's license, and a letter, and then we have to assess it, and then we can make an appointment for you. I'm like, I'm having an emergency now. I'm having problems breathing and swallowing. They're like, well, we won't be able to see you right now. We don't do that. So that was the problem. It was like, okay, the only way I was going to get help, and this is what I had to do, is to go to those private emergency places to see if I could get in and just see what I had to do. And I had to be on IV fluids, IV antibiotics and a bunch of other things. And it was very scary. And most of it was happening late at night. So I had to, I didn't want to go, it's COVID and you can't get into the hospitals really. And so it was just awful. And you felt so devalued. It's like, well, you're not a real person, and you have to be poor enough, and then maybe we'll look at you. They told me to my face over the phone, it was going to take at least 72 hours from the day I bring in all my paperwork for them to look at. So that'll let you know. That's awful. Nobody should have to feel like you're inhuman and out there and afraid. That's the way I felt. I felt afraid.
Kind of redefines emergency, doesn't it, Corlie? Well, I already shared my story with you. Apparently, I jumped the gun. I didn't have the slides in front of me. But the most recent, it doesn't matter who you talk to, somebody has a story. And the most recent story that I heard was from a woman I met in the park when I took my grandkids to the park a few weeks ago. And as we got to talking about, introductions and what do you do's and all that stuff, I told her about my work with HJAN and what it was about. And she told me about the birth of her second child, which was here in Texas. And it turns out her daughter has Down syndrome. And when I was talking about the lack of therapies that my grandson is suffering from, she just started nodding and told her story about how difficult it had been. Her husband's job ended, so did their insurance. And all that gap that we've just been talking about. that, I mean, this was a well-earning family that suddenly was one of those families that had to scramble and really didn't even know how to scramble. And there's very little help out there. And the last thing she said about this was that, in fact, we're even thinking about moving out of Texas because health coverage here is so bad. And they have their daughter with Down syndrome, who was just adorable. But that's just, again, that's like being #1 in the nation in uninsured. It's just not something that should make Texas proud.
Oh, so my niece works part-time. She and her husband both work part-time. Neither one of them have insurance. And the thing is, if you work $10 an hour for 40 hours a week, you make enough to still be under the poverty level, in the poverty level. You're not above the poverty level with that. But the kicker is you don't get 40 hours a week when you're working part-time. I mean, you get 20 hours a week. You might get 25 hours. You get just enough so that you cannot, be offered health care.
Yes.
So, yes, that's right. And so she and her husband were working, and they were working during the pandemic because if you don't work, you don't get paid, right? And so they were taking public transportation. My niece got COVID, and she didn't know it. She was fine, but her husband got COVID from her. And again, they don't have insurance. And so they're self-quarantining. He's in the bedroom. She's handling the 2 kids by herself, trying to work as well and care for him. Because they just can't go to the doctor because they don't have the money. So that's their situation. But that was the situation of a lot of Texans. A lot of Texans are either single parent, trying to work 1 to 2 jobs to make enough but not have health care. 2 parents working, struggling, trying to make it. That's the reality of many, many families in Texas. And what was going to happen, what we were fighting for, was for Texas to expand coverage to people in that gap. And so we've been meeting on Mondays from 4 to 6, and each time we meet, we give directions for that week. So right now, we've been supporting Bill 3871, which would expand coverage in Texas. It's a bipartisan bill that has 76 co-sponsors, Democrats and Republicans. There was a showdown in the House last week during the budget vote, where there was an amendment that would have basically allowed the state to do what 3871 is calling for, because the chair of the committee is not letting this get out of the committee because the governor has instructed them not to let these bills out of committee. So they were going to do a budget rider. And on Wednesday night, before the Thursday vote, the 8 Republicans were picked off. They had previously said yes, that they supported this, as did many others. However, they were offered incentives, reportedly, to not vote for the expansion. And so that was a big blow, because we had for the first time, we had the votes to move this forward in the House, and they chose not to, because they said because it didn't have a hearing. That was the formal reason. However, they're not letting the actual bill get out of committee, so it can't get a hearing. That kind of stuff that's going on. However, as a result of the push and the groundswell for coverage expansion, 2 other bills that have never been passed before, that people have been fighting for at least 8 years, now have passed the House and they're on to the Senate. And that's SB 290 and HB 133. I think I got that right?
Yes.
So they're in the Senate. What they would do is they would allow 12-month continuous enrollment in Medicaid. So one of the things that the state does, a little budget trick, is when it needs additional money, what they will do is they will go back to a 6-month enrollment for programs that for poor people. And what that is a cut, but it's not seen as a cut. But they know that that's going to save money because they know people will be knocked off because of how hard it is to re-enroll. So that's one thing that they're looking to change, which is a good thing. The other is it would extend the amount of time that moms can be on Medicaid after they give birth because of many problems and issues that women are having after giving birth. And they see that they need additional care. And those two bills actually have even wider spread support. And those are good bills, but they're not coverage expansion. They're very limited in scope, and they cover the same people that are already covered or that already have access to the coverage. It's not an expansion. So we're asking for support for 290 and 133. And while I'm sharing my screen, I can't pull up the HJAN page, but that's pretty much it. Let me stop share. Any questions for us on things that we've said so far?
I just want to take a shout out to St. Thomas and say one of the things that Michael and I have always been very impressed about is that your church is an advocacy church. Your church is a church that gets in, rolls up its sleeves all the way down to the elbows and understands. And that even though and many of you know that area is considered to be affluent, there are pockets that are not. There are those of us who are still struggling. And one of the things that really breaks my heart is that this is particularly true for those of us who have committed to the ministry of nonprofits, to put our heart and our time and our energy in to making the world a better place, to making it what we can to doing that. And we can't get insurance because we don't get paid. That's the gift. We don't give real money. We give our time. Right. And so it's like, it's interesting because one of the reasons why Texas is number one in uninsured, it's also number one in nonprofits, because we've had to say the only way that our children and our sisters and brothers and our husbands and wives are getting covered is for what we do. We will do nonprofits say, okay, we're going to step in because the state's not covering that. We're going to step in. And so now all of our churches and whatever, we're stepping in. And so what we're saying too in HJAN is that as citizens of Texas, when we can step in and do this and just let them know, to hear our voices. We're not asking for anything else other than we would like you to help us, to help you, to help them hear the voice of those of us who are struggling so hard. I can't tell you the fear and trepidation being here at 10 o'clock at night, knowing that I might just drown in my own fluids because I couldn't swallow. Okay, that's just me. Okay, and that's just that moment because I'm in that 18 to 64 gap. And, so there it is. And when it gets to 65, then I'll have the Medicare, but still you have to have those issues. And then I can get to worry about my children and my grandchildren going through the same thing. So this is just important. And those of you that might have a little bit, have the energy and the love to do that, we're calling on you, have a little bit of time. It's not a lot. It's just, but we need your voices because together, we're bind us together, Lord, with cords that cannot be broken. These are cords of health. These are cords of love. These are cords of well-being. And as we go toward beloved kingdom and us being healthy in mind, body, and spirit, these are things that are important. And so I come to you, Curcio, Daughters of the King, Episcopal Church women. Those of you who know me, you know I'm in it all the way. And I need you all. I need it all. So I'm St. Thomas, I'm proud to know you and to know who you are. And because of who you are, I'm hoping that you will join us in this That's all I've got to say.
Was this helpful?
Yes.
I put in the chat the link to our resource page. There you can get all kinds of information about coverage expansion, as well as several presentations that were made, as well as access to all the research documents that have been done. Every economist, every major economist says that this would be a win for Texas. Any other questions that you have for us? Any things we need to go into further? Questions about what you can do. Join us on HJAN Mondays, 4 o'clock. We're going to do probably like 4 to 4:45 on tomorrow, because we have In Common tomorrow, which is our first stage. It's going to be addressing poverty at 6:30. But we'll hop on to talk about the results of the budget vote and what the next steps are. And so that HJAN Monday access code is on the HJAN resource page, which is in the link that I gave you.
And if you'll click on it now and open it, then when this screen goes down, you'll already have it. So.
And it's full of resources. And well, thank you, Kathy. I'm glad that you like that, because it's so important. And it's just the little things that we can do. Because so often you always go, I can't change the world, but they say, take off the little bite. Well, the little bite is making calls, and the little bite is just sending popping off an email, which is really, really quick. If you have it, you go to the Secretary of State's page and you see your rep and you just click email and you can just type it. Or there are even places that we can show you to go, and you can all you have to do is write opposed. Yes, no, that's all you got to do. But they need to see that somebody's taking the energy to do it, and to know.
And it doesn't have to be a lot. We're not asking you to do 500 postcards or make 500 calls. But if each one of you that shows on the screen, let's see, there's 16 times makes 5. 16 times 5 is a lot. So it's not hard, and together we can get this message across.
So I want to ask a question. So Graciela and Tim, how are you doing over there? I see that you're listening. Do you have grandkids that are being affected by this also? No, okay, you're on mute. They're on mute.
We don't. We have one that maybe, I'm not sure.
Mm-hmm. Well, we would certainly love your help. And also, like we say, each one teach one. So, and if you ask 3 of your friends to do it, you can make 3 calls or get some of your friends to do it. That would be good. To just tell them, this is not good. This, we need healthcare. And you all, we're feeling better because most of us have gotten our shots. But I got to tell you, without healthcare, for the while, we couldn't get tested. For those of you, how soon we forget. Those who didn't have any real health care before they decided to have, the screaming, we're screaming, we can't even get in. You had to have health care to be able to even get a test to find out if you did have COVID. And then whatever. So it's just, and we just need you.
Hey, Corey, who do we call?
Well, thank you for asking. We call your representatives. And that's why it's important that you all do it, because they hear us, because we live there. We tell them, you're supposed to be representing us. This is important to me. This affects my family and my health. And so for you, it would, I don't think if you may have Mays Middleton or Larry Taylor is your senator. Mays Middleton may or may not be your congressman. I think maybe Bonin may be your congressman.
Dennis Paul.
Dennis Paul. All right then. So we would talk to Dennis Paul. We would talk to your state. I think Larry Taylor is your state though, is your one over there. And call and let them know. And then on the HJAN page, and one of the things that we love on Monday when we get ourselves informed and activated is that the call to action tells us, so we have very productive use of our time. I like that too, because I'm still working. I'm still a I call myself a 1099, which is a private contractor consultant. And so I'm always, trying to do it. So anyway, it's nice with the alerts because they're very specific. They'll say, call Dave Phelan, call your representative, Dennis Paul, call whoever, and then make those calls, like 3, and then send them an email too, if you can, but at least make 3 calls. And if you can, drop a postcard in and go, I oppose it. That's all you got to do. I oppose, please do it. This is important to me. Those type of things. Nothing, too strenuous, too hard, whatever. But we need the numbers and we need them to hear our voices. And also remember that we speak for those who can't speak for themselves. So that's a little bit.
On the legislative page for the legislature, when you bring up a particular legislator's page, there's a place on there that you click and you can email them. Okay. I emailed 20 people within about half an hour or less. Well, it had to be less because it only took about 15 seconds. Once I built the email and I just copied it, and all I had to do was hit send twice. Hit send twice. I learned that. But then you go and you get another one, you just paste it in there, do the same thing, and you can contact 20 people in a very short time. And everything makes a difference.
It's because of that kind of work that they advanced 290 and 133, because those are things that they were not going to do, but they did it to try to relieve pressure from the growing support for Medicaid expansion, because for the first time they had a majority of the House sign on to a coverage expansion bill. And so as soon as that happened, either that week or the very next week, they came out with a Texas health care package, a conservative health package, which included 290 and 133, which is directly aimed at taking away support for 3871. And again, 290 and 133 are good by themselves, but that's something we should have done 10 years ago. It's not something that's progressive at all.
One of the things that I'm on other things because there's such a frustration in my spirit. I don't know if it's generational or whatever, but it's like I just can't keep seeing all the things happen to us and to my kids and to the people I love. And one of the things I notice is that they've been doing what they call, and you all know this, that stopgap moment, like putting the chewing gum into the thing, to just hold it together. And that's what that waiver was. And that's what's happening. And that's a part of the strategy not to pay this money. We still got all this money just sitting there, not being used. And they said it's too expensive. So we're going to keep that there. We're not going to spend it. You're disposable. Your life isn't worth this. We're just going to keep this here. And, you all figure it out. And by the way, we're going to give you a Band-Aid and then tell you in 10 years, that was the funny part of the waiver of 115. And in 10 years after that, we'll see how you're doing. The emergency state an emergency state should not be lasting 10 years. You shouldn't have to put up a situation that's going to make you wait 10 years to get a real answer. So it's like I'm bleeding and they gave you a Band-Aid and you come, you're gushing and you come back, they go, well, here's another Band-Aid, but and I got Band-Aids for 10 years. We're not going to stop the one. We're just going to keep giving you a Band-Aid. And soon they're going to say you done used all the Band-Aids we allotted you. So those.
What Corlie's referring to is the 1115 waiver, which was a Band-Aid because the state did not accept Medicaid coverage expansion back in 2013. And so the Trump administration on the way out, accepted Texas's last minute 1115 waiver proposal, which wasn't due until October of this year. And the President Trump accepted it and accepted it for 10 years, extended it for 10 years. He did that in the 5 days before he left. This past week, President Biden rescinded that 1115 waiver, saying you expedited the process and did not allow for public comment for no good reason. You circumvented the public process. You rushed this in. There was no cause for you to do that. And so it was rescinded. And so now the state has until 2022 to get this redone. And that also created urgency. That hearing around that needs to happen still. The state is going to have to do that, and it can do it in between sessions. And so that's another reason we have to keep pushing, because that waiver has to be filed, and it needs to be one that's going to be good, not just a stopgap measure. But folks, if the waiver is not accepted, then you're going to have hospitals closing down around the state because they won't have money. So that puts the ball in Texas's court to put together a good proposal and have public comment. That it won't be coverage expansion, but it is something also we can make better than what was submitted.
Sometimes that's all we can do, but we have to keep hold them. You know, they're supposed to be working for us. And this is cross purposes. It's cross purposes for anyone, I think, with eyes to see. So that's why, you know, like I said, the actual question, am I my brother's keeper? And we always forget that the answer was yes. We remember the question. We often forget the answer. The answer is yes. In that
I just saw the chat. Yeah, that's actually very common. When I ran a nonprofit in another lifetime, one of the things we prided ourselves on was we didn't pay anything, but we did provide everybody with health coverage, and it was expensive, but that was something that we prided ourselves on. But yeah, that is real. That's very, very real. Father, how are we on time?
Well, we're okay on time. I think we've got about 5 minutes if anybody has any kind of last minute questions.
Julie, I see you looking with great intent. I feel your brain working behind those eyes. What are you thinking?
I wish I could have been here earlier to hear the whole talk, which I wasn't able to. I'm a physician.
It's recorded.
Yeah, I know. I'm going to go back and watch it tonight, trying to keep my kids entertained. Anyway, but I'm a physician and I feel very strongly about this. I think it's absurd that we don't provide healthcare for everyone. I think it is. I think it's a really difficult, big issue, and I understand that. But I think there's something very basic about it that people deserve to have healthcare. And as a physician, it's incredibly frustrating to know what a patient needs and not be able to get it to them, right? And then I think about all the patients that I don't even get to walk through the door, right?
Dr. Trible, if you could contact, if you haven't already, your legislator, because part of their argument is doctors don't want this because the compensation levels are so low. And so to just have a conversation with them, and the bill that we're trying to get through, 3871, would address that as well.
Yeah, for sure.
We have, in fact, we're a part of a greater movement. I mean, we have the National Association of Social Workers, of nurses, some physicians. We have mental health. That's a whole nother thing we haven't. We talked about mothers and pregnant mothers, but the whole thing on mental health, their NAMI is like insane, because you know what, where are they going to get it? And one of the issues is that, well, if you're disabled, but do you know how hard it is for the mentally challenged to actually be able to get on SSI and be considered disabled and to do all those things? They normally just incarcerate them and let the police deal with their mental illness. So we've got all of that. So I really feel you, Julia, because it really affects us on that level. And so many of my friends, nurses and whatever, are saying, yeah. And knowing about the rural hospitals, because we've lived in East Texas and Central Texas, and some of those places out there, Burnett and Taylor and Hillsborough and all those places, they live off of small rural hospitals. And the hospitals have been cut to the bone now. With the other stuff, they'll actually close down because they went from having hospitals with doctors in it, then they put all the PAs in it to cover the stopgap, and now they won't be able to even afford PAs in there to cover. And I have personal experience with how that works, where you had to go to the emergency, and then they tried to help you, and then they go, well, let me call the doctor. I'm like, the doctor's not here? No, the doctor doesn't stay here. We call the doctor when it's, so I was like, oh, okay. Well, yeah, call the doctor. This is a good idea. Don't get me started. So anyway, but God is good, but these things happen and we don't want them to keep happening. I don't want to keep experiencing them, I'll tell you that. So great. So go share with, on your Zoom. I keep forgetting we're not doing in person. I'm so an in-person church person. And one of the things I huge miss is peace and peace of the Lord. So I'm going to give you all this morning my peace of the Lord. So, okay.
Patty, Willie, and Corlie, thank you so much for sharing from your heart and ways that we can actually do something. And I look forward to doing it because our motto here is we can do more together. So that's what we want to do.
Can we steal that?
Yeah. Well, the other thing is no one can do everything, but everyone can do something, right? And so again, we can do more together, and that's what we want to do. Thank you, everybody. I will see you next week. Remember, Bishop Andy Doyle will be with us at 9 a.m. Bring your hardest questions, your most difficult theological and social justice questions. That's his job, and that's what he's asked us to do. So I hope, again, we're not going to be nasty about it. Bring things that you really want to know and make them hard. That's what Bishop Doyle wants to do. So again, really Patty, that. Willie, and Corlie, bless you. Hope you have a wonderful Sunday, and thank you for the work you're doing.
Bless you. The peace of the Lord be with you.
Thank you.
And also
Thank
with
you all for being here.
There you go. That's what I needed.